Hi! Do you know which profession has the highest suicide rate? Give up? Physicians. Cross-sectional studies of physicians have found burnout to be independently associated with a 200% increased odds of suicidal ideation and 25% increased odds of alcohol abuse or alcohol dependency. My name is Lacey Merrill. I work in the healthcare system as a certified nursing assistant 2 at a level 2 trauma center hospital. The statistic I just shared with you about physicians came from an article titled Burnout Among Healthcare Professionals, published in 2017. Studies estimate that a doctor dies by suicide every single day in the United States, as stated by Dr. Edward Ellison, Executive Medical Director and Chairman at the Southern California Permanente Medical Group. On May 21, 2019, Dr. Ellison cited 44% of physicians display signs of burnout, which is physical and emotional exhaustion that can lead to insomnia, lack of appetite, and other mental health issues. He said a main reason healthcare professionals begin to feel burnt out is they are often subjected to rigorous schedules and forget about taking care of themselves. I did not look up nursing suicide rates or ideation, but I would venture to guess the numbers are comparable to physicians. A large number of studies suggest that work-related stress fuels burnout and job dissatisfaction among healthcare professionals. So the question arises, how can we care for our valued healthcare employees? How can we care for the very people caring for us? I think we need to educate them on self-care. We need to provide comforting, soothing atmospheres for them in the workplace and encourage them to get outdoors, to be active, to enjoy family and friends, enjoy hobbies they love, and take quiet moments alone. They need to decompress from the demands of caring for others over themselves all day long. Hospital employees who work 12-hour shifts are allotted one 30-minute lunch and 3 additional 15-minute breaks. I always look forward to my break times when on shift so I can sit down and breathe. After work, I walk to my car and sit down. When I sit in my car, I'm flooded with doing, caring, and working nonstop all day. I take a few deep breaths and I can feel that my mind and body are overly stimulated. I have a 30-minute drive home that gives me the opportunity to relax and decompress a little before I have to get started again on necessities, responsibilities, and life demands at home. This week, I was introduced to the practice of mindfulness meditation. The Very Well Mind website states that mindfulness meditation is a practice involving the focus of your mind on your experiences in the present moment. While I had zero expectations of what I would think or feel about my mindfulness practice, I was really surprised by my experience. For months, I have been going. This simple 15-minute mindfulness meditation while I sat quietly on my couch slowed me down enough to actually feel and focus on what my body was feeling and release my emotions. This practice gave me clarity to my life and triggered me to make real-life choices and changes to better accommodate my responsibilities and personal wellness. While I was unaware of my stressful situation because I place a lot of pressure on myself, I was able to relieve some stress and feel more confident about my ability to maintain a school, work, sleep, life balance. I think if we educate and encourage our healthcare professionals to seek self-care and compassion for themselves, we may have a better and safer healthcare system for our patients. There may be better job satisfaction, better patient satisfaction, better teamwork, less medical errors, less patient mortalities, and less healthcare-associated infections due to healthcare professionals' stress and burnout. Applying mindfulness meditation is easy and doesn't have to take a lot of time. These practices can be 3 minutes, 5 minutes, 10 minutes, 15 minutes, or 30 minutes, and can be done during a break at work. A couple websites that offer free guided mindfulness meditations are mindful.org and palouse-mindfulness.com. You can also download a mindfulness meditation app to your phone. Some apps to try are Calm Insight Timer, Mindfulness Studio, or Stop, Breathe, and Think. I hope you will consider the importance of self-care and self and stress management interventions for the care of our healthcare professionals. Interventions such as mindfulness meditation practices can help reduce stress and provide a way to bring balance to our overworked, overstimulated, heading to burnout healthcare professionals. When you visit or see your healthcare team members, be sure to tell them thank you for all that they do. I would like to conclude this time with a couple kind, self-loving quotes. Almost everything will work again if you unplug it for a few minutes, including you. That was by Anne Lamott. And finally, self-compassion is simply giving the same kindness to ourselves that we would give to others, by Christopher Germer. Thank you for watching my video.